urge so that you avoid bladder infections. Drink plenty of water to avoid becoming dehydrated. 4. Abdominal cramps. You may experience mild cramping or bloating. This can be caused by the egg implanting or from your uterus stretching. While mild cramping shouldn't cause alarm, contact your doctor immediately if you experience severe pain that doesn't go away. 5. Vaginal bleeding. Light bleeding, also known as spotting, around the time of your missed period is usually considered implantation bleeding. While spotting can be caused by many factors, always let your doctor know if you notice any spotting or bleeding at any time during pregnancy. 6. Fatigue. As your progesterone levels increase, you may find yourself feeling sleepy and losing energy. Fatigue is most common during the first trimester, but some people will experience fatigue throughout their pregnancy. 7. Breast changes. You may experience tender, sore, swollen, or fuller breasts as your hormone levels change. This is one of the earliest symptoms of pregnancy and may appear soon after conception. 8. Food cravings and aversions. Your changing hormones can lead to a change in your appetite. You may find yourself avoiding foods you used to enjoy, or you may start craving foods you don't commonly eat. You can begin experiencing food cravings and aversions early on in your pregnancy. 9. Constipation. Your food will start moving more slowly through your digestive system to give nutrients more time to be absorbed into your bloodstream and reach your baby. This delayed transit can lead to constipation. Eating more fiber and drinking lots of fluids can help relieve or eliminate constipation. 10. Increased vaginal discharge. Vaginal discharge during pregnancy may be expected. It should be thin, white, milky, and mild smelling. If the discharge is green or yellowish, has a strong smell, or is accompanied by redness or itching, you should contact your doctor. This is likely a sign of a vaginal infection. 11. Mood swings. Pregnancy can cause a lot of emotions. Not only can the idea of a new baby cause emotional stress, but the changes in your hormones can also affect your emotions. It's perfectly fine to feel a variety of emotions from day to day, such as elation, sadness, anxiety, fear, and exhaustion. If these feelings are extreme or last more than a few days, consult your doctor right away. Warning signs of a miscarriage. According to the American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. Signs of a miscarriage include vaginal bleeding, the most common sign, which tends to be heavier than spotting and may contain clots. Abdominal or pelvic cramps. Back pain. Call your doctor if you experience any bleeding during pregnancy. An ectopic or a tubulate pregnancy is a pregnancy that grows outside the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and can be life-threatening to the birthing parent. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, dizziness or fainting. Call your doctor right away if you feel as though you are having symptoms of an ectopic pregnancy. Your baby development. The 5th week of pregnancy marks the start of the embryonic period. This is when baby's body systems and structures begin to form, such as the heart, brain, and spinal cord. Your baby's heart beats at a steady rate now, though it may not be detected by ultrasound for another 1 or 2 weeks. The placenta is also starting to develop. At this stage, your baby doesn't look like a baby yet. The embryo is growing quickly, but it's still very small, about the size of a pen tip or a sesame seed. Around this time, baby initially measures just 2 to 3 millimeters. Your body is gearing up to go through big changes, too. Pregnancy hormone levels are rapidly rising, and your uterus will begin to grow. You won't look pregnant for a couple more months, but you may start to experience symptoms now. Twin development at week 5. If you're carrying multiples, you may be able to detect your babies through an early ultrasound during week 5. Your babies are measured in millimeters at this point, but you might see 2 gestational sacs or even a couple of tiny fetal poles as the week goes on. Occasionally, you'll detect 2 gestational sacs at this early stage, but only 1 baby at a later ultrasound. This is called vanishing twin syndrome. There's often no clear reason for the loss, per 2021 research. You may have cramping and bleeding, or you may have no symptoms at all.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantoliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry. 7 weeks pregnant, your baby's development. Although your baby's brain development will continue long after birth, the basic sections have formed. As the week progresses, the digestive system and lungs are also developing. Tiny facial features are also starting to take shape, and each little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and also eliminates your baby's waste. If you have a prenatal checkup scheduled for this week or sometime soon, and have an ultrasound exam, you may have an opportunity to see and hear something amazing, a heartbeat. Don't worry if this isn't in your healthcare provider's plans quite yet. The size of the embryo at 7 weeks pregnant. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration: placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body at 7 weeks pregnant. The pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more pronounced this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your healthcare provider right away. Nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavier bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there.